Hi, Dr. C. I talked to a coworker today regarding one of her relatives having stage 4 breast cancer. I'm very sorry to hear that. They told her she would have less than 5 years to live. Would carnivore help? I think that it would. There are a ketogenic carnivore diet. There is a growing body of evidence in the literature showing that ketogenic animal-based diets, like a carnivore diet, it doesn't have to necessarily be a carnivore diet, but just a ketogenic animal fat diet, because it's the animal fats that are good for you and the plant oils are not so good for you. And the studies that show the best results are the ones using meat. They're eating animal fats and things like that to get into ketosis. And then other studies on ketogenics, generally in mice, giving them a bunch of like Crisco and hydrogenated vegetable oil, which does not exist in nature, and yet we're giving them to animals and people, and saying, we're getting strange and possibly bad, blood markers and biomarkers from this ketogenic diet. And it's just like, yeah, well, no kidding, you're giving them poison, and so they're in ketosis, but they're also giving them poison, and so I'm not surprised that they're getting bad results. The ones that are getting the best results are the high-fat, animal-based ketogenic diets, like a carnivore diet. And depending on the breast cancer too, that's been more studied as well. I remember seeing a study on triple-negative breast cancer responding very well to ketogenic metabolic therapy. Always remember that Dr. Otto Warburg showed nearly 100 years ago that cancer is a mitochondrial metabolic disease. It's not a genetic disorder. And then Watson and Crick came along and discovered DNA, and everyone just went, everything's DNA. Well, most things are stored in the DNA, but that doesn't mean that the DNA is the brain and the powerhouse. The mitochondria are the powerhouse. They're actually moving around in the cell and actually turning things on and off and running the cell as if it were a ship. The DNA and that information it codes for is very important, but it's sort of the blueprints. It's not the architect and the builders, right? The mitochondria are the workers and the architects. They're using that information and the proteins that it's producing to go and do work elsewhere in the cell. Now, it's a bit more complex than that, because the DNA can actually, self-control which proteins get expressed and so on. But that's like a chemical dynamic, and based on gradients and other sorts of signals that the DNA is getting, the mitochondria are actually moving around doing work, and so they're very, very, very important. And excuse me. And so we have something called the Warburg effect, which is that cancer cells require 400 times the amount of glucose as normal cells do. And so it has, has been shown that when you restrict glucose and sugar and you go into a ketogenic state and you get your GKI low, your glucose ketone index, your blood sugar is low and your ketones are high, that actually shows survival benefit in cancers of all different forms. I mean, there's dozens and dozens of studies in multiple different cancers, like dozens of studies in each of these different cancers, including breast cancer, showing significant improvement with ketogenic metabolic therapy. All the studies that show the most benefit are the ones that have the least carbohydrates. So I have some that have sort of middling, like, is it all that much better? Where they're having, low carbohydrate. Well, what the hell does low carbohydrate mean? It's ambiguous. So some of them, like, below 200 grams of carbohydrates, that's a low carbohydrate diet. Well, that's intensely high from my standpoint, because I don't have any carbohydrates outside of the glycogen that shows up in meat and organs. And I don't even have that many organs. It's really just meat. So then there's other ones, like 50 grams or, 20 grams and 10 grams and 0 grams. As you go down, people tend to have better outcomes. And so you keep that GKI under 2.0. That's considered therapeutic. And you do that from a combination of a ketogenic diet, like a carnivore diet, and potentially restricted eating, You need to include organs if you're going to do that, because you still need the same amount of nutrients. You just want less energy coming in, and potentially fasting. If you can't get your GKI under 2 or even under 1 is preferable for periods of time at least, so that you can sort of have this sort of constant pressure of low access to energy. Then fasting can sometimes help that, and help sort of tip the balance and get you into that more ketogenic state. So good luck to your friend. Maybe show her my interview with Professor Thomas Seyfried, Seyfried, where we talk about cancer and cancer biology, and it's pretty amazing. It's a hour and 40 minutes long, talking about cancer biology, and it's my most watched long video. It's like 2 million views nearly, or maybe even hit it, but that was 1.9 last time I checked. And then my lecture at there was a medical conference in San Diego last year, and it was just called ketogenic metabolic therapy as a novel adjunct to standard of care in cancer. Bit of a mouthful, probably not a punchy enough name to really make it go crazy on the algorithm, but it's a good talk. It has good information in it anyway, and so I would recommend taking a look at those and seeing what she thinks. And at the very least, it's not going to hurt. It can help actually make chemo and radiation more successful by sensitizing the cancer cells to the chemo and radiation, and protecting her healthy cells from the chemo and radiation as well. So I would take a look at those and maybe show them to her and see how she does, because it's cancer is really nasty, and you have to throw the kitchen sink at it. Otherwise, you're just sort of giving into fate, and that's not it's not a good fate to give into. So I would definitely try that. It's not going to hurt her at the very least, and I think it would help. Yes, and that's what the data shows anyway. And the thing is too, you can talk to a doctor. If her doctor has a particular feelings on, oh my God, don't do that, that's a discussion she can have. But the vast majority of doctors that or an oncologist that I speak to, and that patients speak to, they say, is there anything I can do with my diet? Should I change anything? They say, no, don't worry about it. Eat whatever you want. Okay, well then eat what you want. And if you feel that this is going to help you along with that, then it's worth a try. And that's what more and more studies are showing to be helpful and increase survival. And that's what we're trying to do here with things like cancer. So good luck to your friend. Hey everyone, really happy to announce a new sponsor for the show and for everybody down in Australia, Stockman Steaks, who are delivering high quality grass-fed and finished pasture-raised beef and other meats, flash frozen and vacuum sealed to your door, something that I've been enjoying a lot of myself recently as well. They also have a great range of specialty items such as high-fat keto mince and carnivore beef and organs mince with liver, kidneys, and beef heart as well. So use code Chaffee today for a free order of beef mince or another specialty gift along with your order at stockmansteaks.com.au, and I'll see you over there. Thanks, guys. Shannon Thomas Trucking, thank you very much for the super chat. It's very generous of you. My friend was told she has non-small cell lung cancer. Very sorry to hear that. They've told her that it is terminal and have her on prednisone, causing massive weight gain even when she doesn't eat. Can fasting and carnivore reverse all this? Well, cancer is an extremely dangerous and deadly and nasty disease. Even doing everything as best that we can, and fasting and doing carnivore and ketogenics and things like that, sometimes it's not enough. And there is a point of no return. But there are a lot of people finding that they are significantly improving their health issues. There have been studies on non-small cell lung cancer and ketogenic diets. I'm nearly 100% sure, just going back to that lecture I gave, I think that was some of the studies I came across were for non-small cell lung cancer. And so it's definitely worth a shot. The prednisone is it's a double-edged sword, because it's reducing the inflammation and allowing their breathing to be easier. But what it's doing also is causing diabetes and massively increasing her blood sugar and feeding that cancer and making that cancer much more aggressive. And it's also suppressing the immune system, which fights the cancer. So this is sort of a self-fulfilling prophecy, is that she's on those medications to sort of help her symptomatically, but they're accelerating her demise, unfortunately. So it just depends on how much left she has in her, how much she has in her to fight this. If she comes off the prednisone to get her blood sugar under control, and she can fast and eat carnivore and ketogenically, and potentially address the glutamine action with different sort of medications, the press pulse method that Professor Seyfried has outlined in several of his papers, and another paper that I'm actually a part of that will be coming out shortly, and that I talk about in the my talk on ketogenic metabolic therapy for cancer, and in our my interview with Thomas Seyfried. We talk about all this. I think it can definitely help, and I think it can definitely help her feel better and get more out of this, and be healthier for longer. And I can't say that it's going to reverse all this. I can't say that it's going to fix her. I can't say that she's going to be able to put this into remission, but I can tell you that others have, and that they are still fighting this. You just have to sort of assume that this is always going to be going on in your body. You really can't stop. And so, if she tries it, I think it's well worth trying. It's, nothing else is really going to do much. I mean, they've already given up on her and said that she's terminal. And so they're putting on palliative measures and just giving her a whole bunch of prednisone, which is just going to jack up her blood sugar and accelerate this. Cancer cells require 400 times the amount of blood sugar as normal cells. And so, you want to do everything you can to keep that blood sugar levels down, not up, because you do a PET scan, you inject radio-labeled glucose, and you see where that goes, and you see ... Oh, that's where all the cancer cells are sucking up all that glucose. So that's what's happening when her blood sugar is high. It's just feeding those cancers, and they're lighting up. So remember that PET scan. Anytime you have a bagel or a piece of bread, or have your prednisone jumps up your blood sugar, you really want to keep that down, because you're just stuffing energy into these cancer cells, which is exactly the opposite of what you want to do. So I'm really sorry for your friend. That's a very difficult place to be in, especially because sometimes, the breathing is so hard that they really can't go off the steroids. And that's really tough. And, it's like for brain cancers, brain tumors, you get a lot of swelling and edema. You have to go on steroids. You have to, because the edema can kill you. Then you do the surgery, you cut out the tumor, and then you have them on steroids for another, several days in a weaning dose, and then you come off of them. When that swelling's down, you've taken out the tumor, so now it's not causing swelling anymore, so you can get them off the steroids. You don't keep them on for very long, if possible. And then you do radiation, that causes more swelling, so you put them back on steroids, and then you're sort of going down that rabbit hole. But it's something that in certain circumstances, when you have brain edema, or you have so much edema in your lungs that you can't breathe, that sometimes these are necessary evils. And the fasting and carnivore diet, being at least ketogenic, so you're not adding fuel to that, I think is definitely going to be a net positive. And hopefully it reduces the swelling down enough as well that she can come off the prednisone and not be so horribly symptomatic that she's miserable or putting herself in danger of respiratory failure. Hopefully that's the case. And if it is, and she can really attack this with, getting her GKI below 2 or below 1, if possible, with a combination of a ketogenic carnivore diet, liver, organs, some restricted eating, and some fasting, hopefully that is enough to start turning the tide back the other way. There are people who have done that, and it's a growing body of them. And there's a growing body of experimental literature of randomized controlled trials and interventional trials that maybe controlled but not randomized, self-selected trials, etc. That that are doing extremely well. And there's more and more. There are more and more of these studies showing that. So good luck to your friend. Hopefully she gets a lot of improvement by going carnivore. Hopefully she's able to get off the prednisone, and hopefully she's able to turn this around. And I think we're all praying for her. So good luck with that. Good luck to her. And have her watch, and you watch my videos on ketogenic metabolic therapy and my interview with Professor Thomas Seyfried, Seyfried. Those are very important ones to know about. Good luck. You can check your actual objective markers, or your CAC score, or your carotid Doppler, and see what's going on. I have a number of patients that have been reversing their atherosclerosis. This is all anecdotal, but they are reversing it. I had a gentleman in my Patreon, Chip, who had 100% stenosis blockage of his right carotid artery. And a year before he started, a year ago, he was on carnivore for a year.